Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Squamous cell carcinoma, and we are looking at the risk factors. So here in squamous cell carcinoma, the risk factors, it includes there's a UV exposure, presence of UV exposure. Next is there is looking at the male sex, it is due to more sun exposure. So this is due to more sun exposure. So it was in UV as well as in male sex due to increased sun exposure. Next, looking at the environmental factors. So here in environmental factors, there is the soreline. So there is soreline as well as the UVA. Soreline and UVA is nothing but the PUVA. Then there is also the physical agents. There is presence of the physical agents such as the ionizing radiation. So there is ionizing radiation. Then comes the presence of the chemical agents such as arsenics. So there is chemical agents such as the arsenics. Next we have the HPV. There is HPV, that is 16 as well as 18. Then comes the immunosuppression. So immune suppression. Next is presence of smoking. And there is a chronic non-healed wounds. Presence of chronic non-healed wounds. And it also includes the burn scars and the chronic dermatitis. So it can also include the burn scars as well as the chronic dermatitis. Next is it may involve the hereditary conditions. So looking at the hereditary conditions, hereditary conditions such as the xeroderma pigmentosa. So we are writing it as XP. Then the epidermolysis bullosa, as well as the oculocutaneous albinism. Oculocutaneous albinism. Then when we move on to the pre-malignant conditions, so pre-malignant conditions such as the actinic keratosis, then the Bowen's disease, as well as the erythroplasia of the curate. So it is a erythroplasia, and this is of the curate. To learn and grow daily like this, please do subscribe.